So now let's talk about blinding in the context of experimental study designs. Blinding is a technique used in experimental studies to conceal certain information from different people involved with an experimental study. Why would you want to conceal information? Knowing certain information could lead to biases in the study. For example, you might want to conceal the information from the researcher. This person might be very invested in a cancer-related medication working, and the results may show that the medication doesn't work. Or the subject. If the subject believes that they got the medication and think that the medication is working, they may report their symptoms, activity levels, or level of depression differently than if they didn't know whether they got the medication or not. Or you might want to blind both the researcher and the subject until the research is complete. For the purpose of this course, let's consider 4 different types of blinding in studies. These include non-blinded, where everyone knows who received the interventions, both the subjects themselves and the researcher and the statistical analyst. A single-blinded study where one category of the persons is blinded, either the subject or the researcher or the analysis. Or you could have a double-blinded study where both the tester and the subject are blinded. Or you could have a triple-blinded study where everyone is blinded, including the subject, the researcher, and the statistical analysis. Phew, that's a lot of blinding, right? If this topic is of interest to you, check out the related resources for this video for a paper by Schultz and Grimes. It gives a great description of why we do blinding and all the types of blinding. Finally, we should discuss some other important considerations that apply to experimental studies. This may be new vocabulary for you, but it is important to know if you pursue your studies in epidemiology, and we hope you will. The first term is equipoise, which refers to a genuine uncertainty about the benefits or harms of a possible treatment or exposure. If we are sure that one treatment is much better than another, then we should not be randomizing subjects to a treatment that is known to be inferior. Placebos are a sham treatment that appear identical to the real treatment but lack the treatment's active agent. Placebos are used in order for the different groups to not realize if they are exposed or unexposed, which could affect the participants' behavior or health outcome. Compliance and adherence refers to whether or not participants follow the treatment, medications, or recommendations, as some participants may not stick with their assigned treatment or exposure. And lastly, intention to treat analysis refers to when subjects are analyzed according to their randomized treatment, regardless of whether they actually got or took the treatment. This concludes our segment on experimental study designs. The most important thing to remember is that randomization of the exposure is the key component of the experimental study design.